and welcome to this very special edition of FYI. I'm Elaine Chang Baxter, the Director of Partnerships for Montgomery County Public Schools. With us video conferencing today is our special guest, Dr. Travis Gayles. He's the County Health Officer and the Chief of Public Health Services for Montgomery County, Maryland. Thank you so much for joining us today.
No problem. Glad to be here. Thanks for the opportunity.
What is the latest update on the coronavirus pandemic here in Montgomery County?
Well, to start with, I'll throw out the numbers. So as of today on April 6th, the number of residents across the state of Maryland who've tested positive for COVID-19 is a little bit over 4,000. I think it's 4,053 cases. And of that number, 793 of those are residents of Montgomery County. I want to emphasize that about 25 to 26% of cases have been hospitalized or continue to be hospitalized at this point. And the cases stretch across ages. I think the youngest case that we've had here in Montgomery County is a 3-month-old who tested positive. And we've seen individuals in upwards of their 80s and 90s also test positive as well. So it's hitting across age groups, it's hitting across geography, across the county. And the other number to point out is, unfortunately, we have seen now over 60 deaths that are related to COVID-19 across the state. 19 of those are Montgomery County residents.
So is the data showing yet? Are we at a point where we also know that people are getting better even though they've been diagnosed positively with COVID? Are we at a point? I know that we just started testing more residents.
Yeah, so it's the other number that does get left off often as we talk about projections and the numbers increasing as well as the number of deaths, is we are seeing a large amount of residents being returned back to society, so to speak, and clearing the infection. And it's important to also reiterate, even though we're seeing increased number of cases and we're expecting to see significantly more, is that the overwhelming majority of folks are having a mild to moderate course of symptoms and disease course. And many of those folks are convalescing at home. They're doing their isolation at home and not requiring to be hospitalized and need further care outside of their primary care provider. So that is something that is hopeful. And something that if you think back, it seems like months ago, but if you think back to weeks ago at some of our early press conferences and exchanges, we talked about there being a number of things that we would watch. We'd watch the number of cases overall. We'd see if there were differences in terms of how things were transmitted. You know, if in the beginning, most of our cases, or all of them in the very beginning, were travel related. And then we talked about if we start to see that change and become more community transmitted, which is where we are now, we expect the majority of cases are community transmissions or related to being in contact with someone who came into contact with community transmission. And then the other thing that we were going to watch is, do we see a change in terms of how the disease progresses? Because originally we expected to see the majority of cases mild to moderate, and that has held true, even though certainly, we're continuing to watch and not use that as a false sense of security for folks to think, oh, if I get it, I'm going to be fine. Because the reality is we've seen all ages impacted by it across the spectrum. And we've also seen a host of ages, both young and old, also unfortunately have not so good outcomes in terms of more complicated disease course and unfortunately in some cases deaths.
So as a Montgomery County resident, I haven't really heard of any specific places outside of the village earlier on that had an outbreak. So when there's a positive identified case, are we sharing as a county where these cases are occurring? If it's a grocery store, are they putting signs up saying that somebody had been here a week ago that tested positive? What's Montgomery County doing to keep residents informed of where some of these cases are located?
So there's multiple levels. I think the first piece of that question just merits a conversation about how we do contact investigations. And so when we get information about a positive case, what happens? So at this point, based upon capacity, and this may change given, from yesterday to today, we got 100 new cases. So As those numbers change, we may not be able to do this as closely, but the protocol has been so far as when we get a positive case, we have staff members call that person and follow up with them and do an intake interview of sorts to assess where they've been. Are there any potential high risk exposures involving their workplace, any community exposures, as you referenced, the nursing home related in one of the early cases. And when we find out that information, if there is a significant risk to the public or individuals who are in those spaces, we do release that information. And so, for example, in that case, we talked about the nursing home. There was a case of an employee of alcoholic beverage services who tested positive. And so as part of the investigation, we were able to narrow down the time windows within which that individual was there to release that to the public and say, hey, if you were here at this time, you should self-monitor and take other actions as needed. So we continue to be committed to doing that because it is a tough balance. We have to also balance the privacy of the individuals and respect their space. But when appropriate, we do release the relevant information to help others guide and know their particular risk. Now, the second layer of that is we have been working as we get more data points, unfortunately, because we're having more cases, is we're working, our epidemiology team is working with our academic partners at the University of Maryland, as well as George Washington University, to figure out how to map the cases. So, looking at some of our geographic tools to do some mapping across the county. And again, we're looking, hopefully we'll be able to release some of that at a level that folks can see geographically, but not so specific that you can start to, again, protecting the privacy component. Now, what's interesting is we're also we use those same data resources to try to map out and predict the number of cases that we can expect, to get some approximation of when we expect to see a peak. And by peak, that means when we expect to see the largest number of cases happening. That would help determine how we distribute our resources and scale up our healthcare facility support. And we're also starting to ask some other questions as we get more data to learn if it is disproportionately impacting certain communities within our county, and how do we address that, and how do we ask the questions to get the information we need. So in summary, we put out information where it's relevant, again, balancing privacy and public health information, and trust and believe that our staff who are doing the investigations and doing the outreach have the relevant information. And again, where we deem it necessary, we do release that to the public.
Where is the information being released? What websites or links would you recommend county residents refer to if they're not already familiar?
Well, the majority of, for example, the instances where we've had some larger venues and released that information, we've been utilizing the old-fashioned method of press releases and follow-up interviews and videos and segments like this to get that information out. The county does have a comprehensive COVID-19 website that is part of the Montgomery County MD.gov web portal, and folks can access and see the most up-to-date information, including links to the state's COVID-19 site that has a daily tracker of cases by jurisdiction, as well as deaths and to some degree some other limited demographic information.
So despite what all is going on, we still have some parents that are saying, hey, can my kids get together for a play date? What would you say to those parents?
What I would say to those parents is what we tell your children in school is to listen to the authorities. What we've said is be very careful, because now we know that we've seen cases in children, because in the beginning we said, oh, well, children aren't as affected. So, if they're interacting with others, they're less likely to spread. The fact is, again, we've seen cases across the age spectrum. And so the same principles that we're asking for adults in terms of social distancing, minimizing exposure to other individuals, the same things we're asking of within our children. And so I say all that to say, again, the same policies that you are asked to do as an adult, you should implement those policies with your children.
What recommendations or advice would you have for parents to share with their kids, the younger kids, not really understanding what all is going on? And if we have some younger kids that are watching this video, what advice would you have to share with them in terms of remaining hopeful about the situation?
Well, the most important thing is that we're working hard to address this, and it can be a little scary, but I think the most important thing is, and in my former life, I was a pediatrician, and I always took
Oh,
the approach of being honest with kids and engaging them in conversation proactively to make sure that they see us as adults as good sources of information to be able to come ask their questions, as opposed to seeking out social media and other places that have information that is less vetted and quite frankly less evidence-based. And so I think engaging children in those conversations to talk about why this is happening, but then also ground that in the concept of how does this change and shape their lives. So, it's interesting, as adults we talk about, well, because we're quarantined now, I can't do X, Y, and Z. It's important to engage children in the conversation to say, hey, normally you do get to go out and play outside. Let's talk about why you can't do that anymore and how that might make you feel. Or, yes, we know that you have friends A, B, and C, and you can't get to see them. So, exploring some other strategies to help keep them connected and help keep them engaged in some semblance of their daily routine, because they're coping with this as best as we can, most often with not as much information as we do in terms of understanding what's happening.
based on what you know now, residents were told across the United States, if you have a fever or you have some respiratory problems, that's probably when you should be calling your doctor. Is that still the case? Am I correct in that assumption?
Yes, so we're asking people again to, basically handle your symptoms the way you would any situation. When you develop symptoms, and now as time moves forward, we're getting a more expansive set of symptoms. So originally it was uh, fever, cough, and shortness of breath. And now we know, in addition to that, there's fatigue as a symptom. There's some suggestion that there may be some gastrointestinal related symptoms as well associated. So say all that to say that when you have symptoms develop, contact your primary care provider, particularly if this is out of the norm, because we know now, for example, it's allergy season. I'm a person who suffers from allergies, so I take my regular routine of medications. And so when I have, for example, my eyes start itching or I have a runny nose, it's a logical explanation of it's allergy season and it's really bad pollen right now. So if you're exhibiting symptoms that can't be explained by something that is historical, seek medical attention. They'll ask some deeper questions to determine if you need to be tested, and they'll be able to provide you the guidance you need to stay healthy. And ultimately, if it's concerning for COVID-19, receive guidance to mitigate any risk of transmitting to others.
What about walk-in clinics? Are those still open right now?
I believe so. There's a host of, Montgomery County has a good network of urgent care facilities across the county, some of which I know are actively providing testing to individuals who meet the clinical criteria following being seen by a provider.
Speaking of testing, are there enough test kits to test whoever wants to be tested, or whoever's doctor says they rightfully should be tested?
So the short answer is there's not enough tests across the board. They test those who need them the most, how that's defined, and CDC has defined that, and the state has defined that in terms of priority criteria. And that typically is those who are in significantly poor medical condition, who are hospitalized, our nursing home and vulnerable populations, our first line responders, and our healthcare workers who've been exposed in high risk settings. Those are our priority tests that are run through the state lab. But again, there is lab capacity through private labs, so providers can order those based upon their clinical suspicion, their exam, and their review of history with patients when they come in to seek their services. Now, we're looking to develop strategies where we can expand access points for individuals to get those services. So, for example, part of an effort in partnership with the state and the governor's office, we will be conducting testing at the White Oak Vehicle Admission Site for individuals who have orders and referrals from their provider or from a provider to be able to get testing. We're hoping that if all goes well, we'll be able to scale that up and do it multiple times a week, utilizing that site And as those details become available, we'll release those to the public.
Being that it is allergy season, if someone has like a runny nose, slight headache, but they actually want to volunteer and help some of these nonprofits that are servicing some community members, should they really be symptom-free for 2 weeks before they actually volunteer?
Yes, well, so we're asking people, and we've been asking them from the very beginning, even as we had a basic understanding of things. If you are symptomatic, stay at home, don't come to work, don't come to school, don't come into those settings where you could potentially come into contact with other folks. So the reality is, again, this is a situation where it begs getting some guidance from a healthcare provider to be able to determine when you are, quote unquote, safe to come back in public. And I want to also take this opportunity to clarify a little bit, is originally, return to public was based upon you've got to be out 14 days, you got to get 2 negative COVID-19 tests, and that's changed a little bit. So the criteria for being cleared, you can still do that, but it also is if you've been determined to be, a COVID positive person or a person presumptive positive or suspicious for it. The new guidelines or the shared guidelines say that at least 7 days after the onset of your symptoms, if you've been fever-free and symptom-free for a 72-hour period, you're considered to be cleared to return back to action.
Oh, that's very helpful. Recently, we've heard discussion about people should probably start covering their faces. Is that the case? And are there any particular cloths people should use if they're making their own face mask?
Yeah, so there over the weekend, and we're actually going to be putting out a statement from the county. There was language from the CDC that talked about there may be some benefit from individuals wearing some type of covering, even if it's a cloth covering in public settings where social distancing is difficult to maintain. So you're kind of like, well, what's social distancing difficult to maintain? So you can think of some spaces, for example, in grocery stores where even though there are efforts have been put into place to keep people 6 feet apart, you can think about where you may come into contact with surfaces in tight settings. So I want to make sure that people understand why masks are beneficial. Mask, if you are an asymptomatic person and you don't have COVID, the mask is not going to protect you from breathing it in. The protective factor for the cloth mask is if you are a person with COVID-19, and now we have evidence to suggest that even in the early asymptomatic period, even though it's smaller than the risk of if you're symptomatic, there is the potential that you can, transmit based upon coughing or talking. It's thought that the cloth barrier can prevent any droplets coming out of your mouth from getting onto surfaces and things like that. So that's what has driven the decision to say, yes, there is some value and utility in wearing masks in public settings. That does not take the place of social distancing, staying at home and sheltering in place, and certainly doesn't take the place of washing your hands and cleaning surfaces when you come into contact with different things.
What about cleaning everything you're buying now from the grocery store? I've got neighbors that say they're like wiping down everything or leaving things in their garage for a period of days if they don't have to bring it in and refrigerate it.
Well, I think there are different strategies that people are utilizing. I mean, I'm trying to think of when we go walk to the grocery store. Just being smart and wiping things down before putting them away and constantly washing my hands. Again, I think there's adage to say, well, if you let your mail sit for a couple of days before opening them up, there's some utility in that. I think we're still finding out more information, but again, I think the biggest point is, regardless of what you're doing, some of the things that we've recommended from the very beginning are helpful. Cleaning surfaces and always washing your hands as you're coming into contact with different things.
Being that you're the county health officer that is making decisions for the county with the governor closing schools, would you ever, additionally, if you felt that the county was inflicted more so than other counties in the state of Maryland, would you actually enforce other closures on top of what the governor's doing?
Well, I think to first answer that question, we constantly assess, are we doing the right stuff? Is there more that we can do? Quite honestly, it's the question that I ask my staff and team every day in the morning when we first get in. before we go home. And it's the question that I ask before I go to bed: are we missing something? Is there something more that we can do? And so we're always thinking through that. And so I would say that if there is an instance where I felt that we need to do more beyond what's already been put into place, we wouldn't hesitate to act. Now, that said, certainly, fortunately, we live in a state where the governor's office has been very proactive about making policies and implementing strategies to address this that are consistent with what we would do here based upon a public health standpoint. It's important, I think, for us to work with our regional partners, both in Maryland as well as in DC and Northern Virginia, because we recognize that any policy that's put into place, it's important for us to all do that in coordination, because people cross the border so easily. And if we've got a strategy here that's not mirrored in Prince George's or Loudoun or DC, it makes it very difficult to truly enforce. And so in addition to our state governor's leadership, in terms of implementing those policies, working with the Secretary and Deputy Secretary of Public Health, the leadership in DC and Virginia has as well have been very proactive and forward-thinking and implementing very similar policies, which are consistent with what we would recommend to prevent new cases from happening.
We have some county residents who debate with their relatives whether or not, like a relative in New York, whether or not that person's been symptom-free, if they should come and stay with relatives in Maryland. What would you advise? Would you advise against that?
Well, first and foremost, every case is different. As it relates to folks coming from New York and the tri-state area, New York, Connecticut, and New Jersey, the Secretary of Health actually put out language and put out a directive requesting that those individuals coming, so if you have traveled there and are coming back, or you have someone coming from that area coming here, is a request that they quarantine themselves for a 14-day period. Before being exposed and going out and interacting with others. And that is based upon the fact that there's such a high number of cases right now in that area. And so that's been put into place over a week now. And so the same recommendations would apply if individuals had those questions. The request and the requirement would be that they quarantine themselves for that 2-week period to mitigate potentially transmitting unknown cases.
Based on the science and facts, what are the latest indications for when we can expect life to return to normal?
Well, some would argue nothing will be normal after this experience. And quite frankly, I think in some instances, we are learning lessons that can be very valuable to how we practice medicine, how we deliver clinical and human services, and how we value public health services, quite frankly. I think this incident has shown that there needs to be a greater investment in our public health infrastructure to be able to respond more nimbly and quicker to these situations. I'll be very candid. This did not happen in a vacuum. You know, over the last several years, there have been significant cuts to public health infrastructure and resources, which has made it difficult for us to be able to respond in a way that we've been trained to do. And that has been frustrating, quite frankly. So there are some things that we hope we have learned and we don't go back to where we used to be. I think it will also be important to understand from a data perspective, there is no definitive date. I can't say August 1st or July 1st or May 1st, things are going to be normal. What we do every day, though, is constantly look at the number of cases coming in, look at transmission patterns to be able to get a good approximation of that. A lot of that depends on what we do, though. If people stay at home and they do social distancing and they do the policies that we've asked them to do, the hope is that will flatten the curve that everyone's talking about, meaning that we will cut down on a significant increase of new cases, thereby limiting the opportunities for transmission and pretty much cutting down on the number of transmission networks that are out there. If we can keep the number down, we can keep the number of people out of the hospital, we can keep more people alive, and those are the factors that will help determine when we go back to normal.
One last thing that I want to ask you is if people want to make any financial donations, is there a way that they can make a financial donation to help support everything that's going on? And then The second thing I want to ask you that's sort of in line with the donations is if people actually have medical supplies, gloves, or uh, other medical supplies that they want to donate to law enforcement or nurses or some of the people in frontline, should they just donate to those sources directly, or is there a county gathering of donations?
Yes, so you can, on our coronavirus website, there is a donations portal that allows for that, both in terms of monetary equipment as well as volunteer efforts. If there are donations of supplies that people have, we are accepting those donations. We're trying to keep them all together and then be able to distribute them to folks who need. We're asking people you can deliver those to our Dennis Avenue site. The Dennis Avenue Health Center is at 2000 Dennis Avenue in Silver Spring, right off Georgia Avenue. And what we're doing is basically compiling all of the materials and resources we get to then be shared and distributed appropriately to those who need it based upon their request.
Okay. Is there anything else that you want to share, Dr. Gayles, before we close out this video conference?
I think the biggest thing is to as best as possible, reiterate to folks that, we've been talking to you now for about a month, and we've been talking about COVID, but this is a continuation of what we've talked about from the very beginning, and hopefully none of what's happening is a surprise. It may create a sense of anxiety, but part of this, these are the natural steps that we take to address these concerns and conditions. And we're working hard to make sure that those resources are in place. We're not waiting for bad things or numbers to get worse to act. We're continuing to act behind the scenes. And even if you don't necessarily see things moving out front, know that that effort is happening in the background to keep you safe. So continue to be calm as best as possible, and rest easy that we are working on these things to get things done. But certainly don't give yourself a false sense of security that you don't have to do those things that we recommended, such as social distancing, washing your hands, and sheltering in place. Those are the strategies that are going to be most helpful in fighting COVID-19.
Thank you so much for this really informative interview. It was incredible. I learned some new things. Thank you for everything that you're doing. And certainly feel free to keep in touch with us if we can get some more messaging out to the community on how they can support and all band together with this pandemic to help everyone get through it.
Sure. Thank you. And I usually start interviews with this, so forgive me. I want to always say thank you to the folks who are in the front line doing the work, from the healthcare workers to the folks in the grocery stores and stores, our environmental service workers, everybody who's doing their part to help keep us safe and keep us moving forward. So thank you.
Absolutely. Law enforcement, government workers, thank you so much for being on our show.
Thank you so much.
And thank you for watching. I'm Elaine Chang Baxter, the Director of Partnerships for Montgomery County Public Schools. Join us next time on FYI.